Hello and welcome to Behind the Lines. I'm Diane Dayton. Today we're going to talk about joining forces, reducing deaths due to opioids and heroin. And we've got a lot of people we're going to talk to and hopefully give a good face to this information and resources. With us right now we have Alice Yoder, your Director of Community Health, Lancaster General Penn Medicine, and facilitator of Joining Forces. Thanks for being here.
Thank you, Diane.
Dr. Joseph Troncale, and you are the Corporate Medical Director for Retreat Premier Addiction Treatment Centers, and there's one right here in Ephrata.
Yes.
What are these centers?
They're inpatient units and outpatient units. We have 175 beds here in Ephrata, and we also have an outpatient facility that can handle about 100 people. These are all people that suffer with addiction. We do detoxification and then we do treatment and hopefully get people back into their communities.
Okay. Alice, last year is when this whole idea came together with Joining Forces. Tell me how this came together, who's a part of it, the goals, that sort of thing.
Yes. Well, Joining Forces started back in early fall of last year, basically from a hospital standpoint when we were looking at addressing the substance abuse disorder issue and what needed to happen in the community. We really found out that there were really a lot of good work going on related to this particular issue, and we all know it's a crisis that now has touched many of us and many of our families, but in Lancaster County there has been for many years a lot of good work going on, but there needed to be sort of a sense of coordination and focused on best practices, what really works well, and how can we make sure we have that in Lancaster County for people here and do more of it.
Yeah. What is the situation like in Lancaster with this?
Well, for the past 4 years, we've seen an increase in deaths from opioids and heroin. It went from 117 in 2016 deaths to 165 deaths. So the number of people dying from overdose is increasing, and we do feel it will continue to increase for the next couple of years, but with the hope of implementing a lot of the strategies that we'll be talking about today, we really feel that there's hope to make a difference down the line. Not anytime soon, but we feel we're in the right direction.
Yeah. Well, we know that a person can become addicted by medication that a doctor prescribes for pain. But let's put a face on addiction and what it really is.
Sure. Well, people come into addiction in all kinds of different ways. There are young people who attempt to use drugs as a recreational sort of a thing, but we also have a lot of people who have legitimate pain issues and that sort of thing. Were put on pain medications by well-meaning physicians, but what most people don't understand is that there's a certain segment of the population who are susceptible to addiction. Not everybody is going to become an addict who takes pain medicines, for instance, or who uses drugs. But people have the genetic predisposition. About 10 or 15% of the population has that genetic predisposition. And if you mix the drugs or the substance with their genetics, then you will frequently come out with someone who has addiction.
Okay. So really, how do opioids affect the brain?
Well, basically what happens is there's a part of your brain that senses pleasure, and opioids attack that part of the brain and cause changes in the neurochemistry of the brain, causing people to have less pain and get euphoric and that sort of thing. In addicts, what happens is that pathway in the brain basically gets dysregulated. And without getting too technical, the problem is that dysregulation causes people to compulsively use. And again, not everybody does that. So not everybody who uses medications or alcohol or whatever who are going to become addicted to it. But once that occurs, the person has a significant problem, just like a diabetic would have problems with glucose control because they don't have enough insulin. People with addiction don't have a regulation of the dopamine in this certain part of the brain. And therefore, what has to happen is they either have to abstain from the substance or they have to be medically regulated in some way.
Okay. How do we know that we may be going down that path?
If, as an addict?
Yeah.
If someone begins to lose control of their use of a substance, but the best way to look at it from a standpoint of sort of epidemiology is your family history. If there are a lot of people in your family who have addiction, then almost for sure you are going to be at higher risk. The genetics are that if you have two parents who are addicted, you have a 50-50 chance as their child of developing addiction.
Okay, all right. Who are the other partners and members with Joining Forces?
Well, Joining Forces is structured with a steering committee and then many others beyond the steering committee. And so we have the County Drug and Alcohol Commission, EMS providers, the DA's office, including other police, and we have many of the social service organizations that address this particular issue, some that you're going to be interviewing today that are part of the solution and what we're looking at. And also we have Compass Mark, who will be on your program today, which really focuses on an important part around prevention within our community.
Right, we're going to right now put the Joining Forces website up on the screen so you can find out exactly who the members are, the partners, and additional information, what we're talking about. This is still relatively new with Joining Forces when we're talking right now. What have you seen so far with this?
What we're seeing is a better understanding of what the resources we currently have in the community and resources that we don't and we need to potentially do more of or start up. So we're finalizing a plan that will be available publicly on a website. And actually the website is one of the first things we heard from the community that we needed to put together is we have the joiningforces.org website that has all the resources and information that someone may need if they're affected by addiction or want to learn how to help and what to do. They can go to that website. All the data and information is also available in one place.
Okay, recovery is possible.
It is. And basically we are trying to allow people to get the help that they need, and also we are also educating physicians to try to help them not use opiates as much as has been traditionally been prescribed.
Okay, that makes a lot of sense. And we're going to talk as we get into the show too, that it is a family situation too where we need to get the members of the family involved with help with the person who may be addicted to and how we can do that. Thank you so much for the work that you're doing and bringing this together in our community. It's going to make a difference. I really think that it is. We're going to take a brief pause and we come back. We've got a lot more information for you. Stay with us. Welcome back to Behind the Lines. We're talking about joining forces and reducing deaths in our area due to opioids and heroin addiction. With us right now, we have Jody Holland. You are Executive Director at the Gatehouse. Thank you for being here. And Deb Bard, you are Drug and Alcohol Programs Director at TW Panessa. Thanks for being here too.
Thank you.
What is the Gatehouse? What do you do there?
Well, the Gatehouse offers an array of services across the continuum of care. As you heard Dr. Troncale talk about, that he works at the retreat. They offer 28-day residential. The Gatehouse, we have 2 sites currently, and they're considered community-based residential or halfway houses, where individuals come to us and live in a home-like community setting for approximately 90 days. We have a clinical component to those sites, but then they also learn about life skills, and really what our goal is recovery based on getting back into being a productive member of society. We also manage recovery houses, which would be a step down from our halfway houses, and they're located within the boundaries of Lancaster County, and that's more where people are really, it's almost like being in your own apartment.
Okay.
It's not necessarily a clinical component. And then we also offer outpatient and intensive outpatient services.
Okay, so what type of person would be coming to you versus some of the other areas that we're talking about?
Typically someone who has been through detoxification or a 28-day residential program. We would see those individuals in our halfway house component. Also individuals who are on Medicaid, because private insurance does not cover a halfway house setting. People in the transitional living or recovery houses, as we call them, those are self-pay. So could be any individual coming from any level of care. Okay. Outpatient and intensive outpatient is probably, and maybe Deb can speak to this a little bit more, the last layer of what we consider treatment.
Okay.
So individuals at that setting could be coming from any array of services.
Okay. So what does TW Panessa offer?
We have an outpatient and intensive outpatient treatment similar to the component that Jody has. We're also pleased that we can offer services to people who particularly excuse me, have opioid use disorder.
Okay.
Through the governor's office, we were awarded a grant about a year ago, and so we have been designated as a center of excellence for behavioral health, which means that we can offer people, in addition to therapy services and therapy groups, we can offer people what we call care navigation. So if they have socioeconomic issues or relational issues or financial issues, that those folks are specifically employed to help them remove any of the barriers they may have to prevent them from getting into treatment, whether it's in an outpatient level or if they move on to a higher level of care.
Okay.
Outpatient is like we can be at both ends of the treatment spectrum. We can be the gatekeepers in terms of being able to evaluate people's and do pre-search with the insurance, get people into detox, provide people with support and contact and knowledge just about how to kind of navigate through that, because the system can be, it's full. I mean, there's a lot of people who need services, and so it can be difficult and people tend to give up.
Yeah.
So our certified recovery specialists really stay in contact with people. They don't need to make an appointment. It's very loose. It's very accessible, because the longer people can stay in treatment and get engaged in treatment, the better chance they have of reaching a point in recovery.
Yeah. How do we get someone into treatment?
Utilize every access point possible and make sure that we have enough beds. And when I say access points, I think in Lancaster County we're fortunate because we do have quite a few of those. Outpatient offices, you know, they can do screening and assessment. The county has a 1-800 number that you can contact. The Warm Hands Off, which I think TW Panessa offers, through emergency rooms. I think the more that we talk about it and the more resources we have, the more points of access that individuals will get. The other thing I want to say about that is that, you know, when somebody's ready for treatment, they need to be afforded treatment. And sometimes that's part of the issue, is that we're waiting on beds, people don't know who to call. So when the individual who's struggling with the disease of addiction is asking for help, making sure that we can get in contact with the right people at that particular moment,
Yes.
so we can open those doors.
Absolutely. This involves the family as well, and there is support for that too, right?
Absolutely.
Yeah.
Yes.
Tell me more about that.
Since the opioid crisis has emerged, there have been a number of initiatives for families to get support. There is, through Eric Kemmel's agency, Compass Mark, there you can find on their website, you can find lists of support groups for families. I think that churches are becoming more involved in offering family support, such as Celebrate Recovery. There is a number of initiatives on a localized level. For instance, the Donegal in Mount Joy, there's the Donegal Substance Abuse Alliance. There's the something fairly new in Ephrata called Ephrata Cares, right here in Ephrata, spearheaded by the mayor. So it depends on what people are looking for. If they're just looking for support and guidance, Al-Anon, Nar-Anon, those support groups are possible. They can call our Center of Excellence and we can take the time to talk to people. I think it's more, people just don't know what's available or what to do exactly. The process is simple, but it can be multi-step. And so, like Jody said, when people are ready for treatment, if there's a wait, if there's a problem to be ironed out, typically people would just sort of disappear and we'd have to wait for them to come back. Now family members can become more involved. They can come with their loved one, they can call, they can get some support for themselves, because they need to keep themselves healthy in order to help the person who needs help, because it can be exhausting.
Absolutely. We're going to once again put Joining Forces, the information, the website up there to find out all of these things that we're talking about. As a family member, how can we really support the person who's addicted?
It's a fantastic question. Make sure that you're healthy. Talk about it. Don't be afraid. There's so much stigma around the disease of addiction. Even though, I mean, we're literally losing thousands, there's still stigma and people are afraid to talk. But there are resources and being able to utilize them. And I want to reiterate, the best thing that you can do is to keep yourself well. It is a family disease. It impacts everyone that comes in contact with the addicted individual. And you have to be making sure that you're taking care of yourself so that you don't do things that not necessarily are more harmful, but may not encourage recovery. recovery.
Yeah, and I think the big thing too is to listen and to be an active participant in their recovery.
Yes.
And to realize that, this is out of their control and we can help them.
And define recovery for yourself.
Absolutely, absolutely. Thank you so much for all that you do. We're going to take a brief pause. We've got more information. Stay with us. Welcome back to Behind the Lines. We're talking about joining forces and how we can actually reduce deaths in our area from opioids and heroin. And also I want to say that on the steering committee, the Lancaster Chamber is also involved with that too. And this work is also going into schools, it's going into workplaces, so we're trying to reach people wherever they are. With us right now, we have Scott Tyre, your chair of Lancaster County Recovery Alliance. Thank you for being here. Eric Kennel, your executive director of Compass Mark. Thanks for being here. What is Compass Mark?
Compass Mark is a prevention agency, so we are focused on really giving people the skills and the resources that they need, especially for children and youth, to prevent addiction. And so we do that in a number of different ways, primarily in the schools through educational workshops, but then we also do a lot of community education, working with grassroots coalitions to really give people skills and resources to prevent the disease of addiction.
Who are some of those grassroots organizations?
Sure. We actually have a community mobilizer who is a full-time person. She works with about 16 different groups throughout Lancaster County. Effort of Cares is one group that was mentioned right here in this local community. They're just getting off the ground, but our community mobilizer provides resources, provides best practices to help advance these efforts in the community. ASAP Lidditz is another group that we're also working with. There's many different groups, and we're privileged to be able to work with them and support them.
That's really good. What does Lancaster County Recovery Alliance do?
Our mission is to strengthen recovery in the communities, largely by raising awareness and confronting stigma that exists for people in recovery and those affected by addiction. So we really want to focus in on raising that awareness as to what the myths are and what the truths are in terms of recovery and addiction.
So what are some of those myths?
A big myth, I think, is occurred if you say the word addict, for instance. The picture that I think people have in their head tends to be not accurate. Addiction does not know any economic boundaries. It doesn't know any social boundaries. And so we're trying to re-educate that we want recovery in our communities. We want it to be embraced. We don't want people to run from it. We don't want people to push it away.
Yeah. What does it mean to be in recovery?
Recovery is very individual, and there's no finish line. It's lifelong. So it's a process to me, it's a process of well-being. And there's different ways you can employ to make that stronger in you. But it's all about well-being. It's becoming a freer person from your addiction.
Why do people keep using drugs? I know that question comes up all the time.
Well, I think, Dr. Troncale sort of explained it a little bit. It really comes down to the changes that occur in the brain, especially opioids and heroin, but even alcohol has been shown to really change the way the brain works. So people who are struggling with addiction are not perceiving things the same way that you or I perceive. They're not engaging in life in the same way. So it becomes a biological, physical addiction as well.
How do we talk to children about drugs?
It's a great question. I think one of the most important things that we often reinforce at Compass Mark is the importance of talking early and talking often.
Yeah.
And that really needs to be done in an age-appropriate way. But having open communication with your child, if you're a parent, or for example, at an elementary age, to talk about it in terms of poisons and things that you put into your body that are not healthy for your body. And then as kids get older, to really talk about the specifics about, if you're in a situation, what is the expectation for refusing that substance? It's important that it's done at an early age, because the majority of youth that abuse alcohol, for example, they start at 7th grade.
Wow.
And so even before 7th grade, you need to be having those conversations, setting very clear expectations for your child, and then just reinforcing that continually.
And it has to come from home has to come school, workplace, community. All of this is related, right?
Absolutely. I think for my personal recovery, had my community not embraced me the way that it did, it could have possibly been a deciding. Well, it was a deciding factor for me, frankly. Community is very, very important. There are so many people that don't get the help they need or don't sustain their recoveries because the support simply isn't out there, or they're afraid to seek it because of the stigma, because people just simply don't understand and they're afraid of things that they don't understand.
Right, right, they are. So we were talking about some of those myths with addiction. What else do we really need to know that we haven't addressed yet?
People recover every day. It's happening everywhere. There's 23 million people in recovery in this country. That's a lot of people.
That is a lot of people.
So we have a lot of evidence to draw from that it works, how to sustain it, what doesn't work. I just feel like we just need more awareness, and we need more people to understand that it's not hopeless, and that, again, there is recovery.
We're going to put Joining Forces, the information up on the screen, which is kind of the central location for all of this. You can find out more information. Let's just reiterate before we close. How can we help someone who is addicted? What's the